Hi, and welcome to First District Health Unit's How to Use Naloxone, a training for community members. My name is Heidi, and I'm a Prevention Outreach Coordinator here at First District. In this course, by the end of the presentation, you should be able to better explain the opioid crisis, recognize the signs of an opioid overdose, explain naloxone and how it works, properly administer naloxone in the event of an overdose, and explain the Good Samaritan law in North Dakota. And if you stay to the end of the presentation, you can learn how to get your own free kit of naloxone as well. So what are opioids? Opioids are a class of drug to reduce pain. There are multiple types of opioids. Most commonly, we know prescription opioids, which are provided by doctors to treat different levels of moderate to severe pain, commonly known as like oxycodone, morphine, hydrocodone, or Vicodin. But there are also things like fentanyl, which is a synthetic opioid pain reliever. It's used very sparingly in the hospital setting and is approved for treating really severe pains like advanced cancer pain. More commonly, we know fentanyl as legally made fentanyl that's distributed in the United States and sometimes laced in illegal opioids or other synthetic opioids, like heroin that is an illegal opioid. So, in most countries, the use of opioid prescriptions is limited to acute hospitalizations and traumas, such as like burns, surgeries, childbirth, end of life care. But we do know that a lot of people were prescribed opioids in the past, which is part of the reason for these high number of addiction rates and overdoses. So what do we know about opioid overdose statistics in the United States? Well, according to the CDC, opioids killed 46,802 people in 2018, and that was almost 70% of all drug overdoses in 2018. And of those 46,000 opioid-involved overdose deaths, 67% of them were due to a synthetic opioid, so like the Vicodin or fentanyl. And because of the COVID-19 pandemic, we are seeing a higher number of relapses and overdoses and a higher number of suspected ED visits due to an opioid overdose. So it's pervasive and it's still a problem in our community. Here's another graphic from the Health and Human Services, and it's just an opioid epidemic by the numbers from the United States. So as we can see, even in 2019, we're seeing about 70,000 people die of a drug overdose, and about 48,000 of those people died due to overdosing on a synthetic opioid. And we are also seeing millions of people misuse prescription opioids or prescription pain relievers for the first time. And we have millions of people that have been diagnosed or have an opioid use disorder in the past year. And we're seeing hundreds of thousands of people use heroin for the first time or use heroin in the past year, or even use methamphetamine. And finally, we are seeing a large number of deaths attributed to overdosing on heroin. Here in North Dakota as well, we are not separate from the problem. We still have people dying of drug-related overdoses and people being prescribed opioid prescriptions. And so we still have to address this problem in our communities as well. And at a local level, we see that Narcan is being used regularly due to an overdose. So the Minot Police Department, when provided naloxone, they used it 6 times within the first 34 days of carrying it. And in 2019, the community ambulance reported administering Narcan to 60 people, and most of them were using opioids for either a recreational drug use or suicide attempts. So, and the graphic we see here to the right is overdose deaths in North Dakota and how they are continuing to increase. So we are not immune to this problem, and this problem is happening. So what is being done about it? Well, the CDC labeled opioid addiction as an epidemic, and the administration, as of August 2017, declared the opioid crisis a national emergency, and there has been an increase of funding from different government agencies and nonprofit grants to address this crisis and expand services to treat substance use disorder. Why are people dying when they take opioids? Well, too much heroin or any opioid causes people to become very sleepy, and their breathing becomes slower and more shallow, and it leads to low oxygen levels, which causes damage to the heart and brain, and eventually this continues, the heart slows down and just stops. What makes you at risk for an opioid overdose? Well, there's a lot of factors that play into it. Very commonly, of course, is if you have used opioids in the past, or you have a history of addiction, or you've previously overdosed, there's a chance you could do it again. For someone that maybe is not using currently, or they've recovered from their addiction, they could relapse and their tolerance could be lower, and they can misjudge how much opioids they can take and cause an overdose. You could have someone take opioids for the first time and there could be fentanyl in it, which is much more powerful, and they might not realize it, so they take too much. Or someone could be mixing substances, especially during COVID-19. We are seeing a lot of issues related to social isolation and taking opioids to kind of address that pain that they're feeling. And of course, due to chronic medical or mental illness, you might misjudge your ability to take these medications and overdose. So what does an overdose look like? When you find someone you think has an overdose, you got to look for the signs. You'll see slow or shallow breathing. They'll sometimes be gasping for air while they're sleeping. They'll have pale or bluish skin. They'll have a really slow heartbeat, and if you check their blood pressure, it'll be really low, and they won't really respond or wake up, even to like a sternal rub where you're rubbing against their sternum with your knuckles. And if you can see their eyes, they'll have really pinpoint or small pupils. So how do we reverse an overdose? Well, we use naloxone or Narcan. What is naloxone? Naloxone is a medication approved by the FDA designed to rapidly reverse an opioid overdose. It can be administered to a person in multiple ways. Today, we will be learning about the nasal spray, but in a hospital setting, you could get it through an IV. Some people will give it to you like a shot in your leg, or also like in an auto injector, so like an EpiPen or insulin if you were diabetic. How does naloxone work? Well, naloxone has a very strong affinity for the opioid receptor of the brain, stronger than opioids do with the receptor. So what it does is it basically kicks all the opioids out and takes over those receptors for about 30 to 90 minutes, which allows the person to breathe again and reverses the overdose. Naloxone, like we said, is only effective for opioids. So on the left here, we see a list of different medications that it'll work for. And then on the right, we of course see medications that'll have no effect of. And those include like alcohol, benzodiazepines, antidepressants, or any mental health medications. Now, just a caveat, if you come up to a person and you think they have had an overdose and you do not know what they have taken, it may be beneficial to administer Narcan. Opioids are taken usually with a combination of other drugs, and naloxone would negate the opioid effects and could save a life. And also, naloxone does not have any negative impact if you give it and no opioids were taken. So there is really no harm in giving it to someone if you're concerned that they have overdosed. How will the person react? Well, once naloxone is used, the person experiences withdrawal symptoms because it kicked off all those opioids out of the receptors. So they experience things like vomiting, sweating, and shortness of breath. But they will also experience different behaviors like confusion, agitation, anger, embarrassment, frustration, sadness, or even just stay very sedated or breathe. You'll just have to be there from them. But just a reminder again, you really can't harm anyone by administering naloxone. In many cases, you save their life. So it's always worth giving to them, even if they kind of react strongly to it. Now we are going to go through a step-by-step of how to respond during an opioid overdose. So here's kind of a general chart of the things we'll review. Like we talked about earlier, recognize the signs of an overdose. We'll call for help, and then we'll learn the rescue breaths and how to administer naloxone, and then you'll stay till help arrives. So when you first come upon a person, you'll check for any signs of an overdose. You'll check if they're breathing, if pale or bluish skin, you'll rub your knuckles on their sternum, etc., and you'll see that they're not breathing, they're not responding. So you'll call 911. Say someone is unresponsive and not breathing, and give clear address and location of where you are. Now, if you're with some people, you can't direct them to call 911, but make sure you address who is calling who and who is doing what. So once you've done that, you're going to lay the person on their back and make sure nothing is in the person's mouth. So now you're going to alternate between giving the person naloxone and doing some rescue breaths. So we'll talk about rescue breaths first before we talk about the naloxone. So what is a rescue breath? You're going to tilt their head back, and you're going to pinch their nose, and you're going to make a seal over their mouth and breathe in their mouth 1 breath every 5 seconds. And what you should see is the chest should rise, not the stomach. And if it does, just readjust where it's at. So once you're doing that, and then you're ready to give naloxone or Narcan, which is just the medication's official name, you're going to have that person still on their back. You're going to remove the Naloxone kit out of its little packaging. And as you can see here, you'll put your thumb on the little plunger, and then your first and middle finger on the outside of it. You do not need to prime this at all because there will be only one shot, basically one dose. And if you prime it, you just wasted it. You'll place it in the nostril, and then once you feel your fingers touch the bottom of their nose, you'll press the plunger firmly to put it in and then take it out of the nose. You'll then continue rescue breathing, and if they begin to respond, you put them in a support position, which you'll see in the video we'll show you. And then if not, you do get 2 doses in each kit, so you'll take the other kit and do another dose in their other nostril. So here's kind of another picture of just like removing the naloxone or Narcan from the package, getting it ready, putting it in the person's nose, administering it, and then if they respond well, put them in that rescue position, or what to do if not. So now we'll be watching a short video on how to use naloxone or Narcan.
Narcan nasal spray is an emergency treatment for a known or suspected opioid overdose. The appropriate use of Narcan nasal spray can help reverse an overdose. Narcan nasal spray is not a substitute for emergency medical care. As with any drug, you need to be aware of important safety information concerning its use. If you encounter someone who is unresponsive and you suspect an overdose, first shake their shoulders, shout their name,
Kevin,
and ask if he or she is okay.
hey, can you hear me?
Then check for signs of an overdose. Unresponsive to touch or voice. Breathing is slow, uneven, or has stopped. Snoring, gasping, or gurgling sounds. Fingernails or lips are blue or purple. Administer Narcan nasal spray as quickly as possible if someone is unresponsive and an opioid overdose is suspected, even when in doubt, because prolonged respiratory depression may result in damage to the central nervous system or even death. Lay the person on their back to receive a dose of Narcan nasal spray. Remove Narcan nasal spray from the box. Peel back the tab with the circle to open the Narcan nasal spray. Remove and review the printed Quick Start Guide inside the package. Hold the Narcan nasal spray with your thumb on the bottom of the plunger and your first and middle fingers on either side of the nozzle. Do not press the plunger to test or prime the device. If you do, you will waste all or part of the dose of medication. Tilt the person's head back and provide support under the neck with your hand. Gently insert the tip of the nozzle into one nostril until your fingers on either side of the nozzle are against the person's nose. Press the plunger firmly to give the full dose of Narcan nasal spray. Remove the device from the nostril after giving the dose. After you have given this medication, seek emergency help right away. Narcan nasal spray is not a substitute for emergency medical care. Move the person on their side after giving Narcan nasal spray. If possible, put their hands under their head and bend their upper leg forward. This helps prevent the person from rolling onto their stomach. This is known as the recovery position. Continue to watch the person closely. If they do not wake up or respond to your voice or touch, or if they do not seem to be breathing normally within 2 to 3 minutes, use a new Narcan nasal spray to give an additional dose in the other nostril.
That's just a general training video of how to use Narcan. This is made by the manufacturer. We will put a link of the full video in the description of any other, if you'd like to rewatch just that video, just so you can get any ideas or want to practice or show any friends just how to use it whenever you get it. But that's that. So after you use the Narcan, remember the person is going to experience those withdrawal symptoms, so expect all those responses of the vomiting, sweating, shortness of breath, but also the confusion, any agitation, might feel sedated. So while they're kind of coming back and kind of gaining consciousness, really talk to that person, let them know, like, hi, my name's Heidi. I just had to give you Narcan. I'm sorry you don't feel good. Please sit up when you're ready. You're safe, or stay lay down. I'm glad you're alive. We're all here for you. And just repeat that until the person is fully awake. If they kind of feel disoriented, make sure you give them some space, but really try to show them that you're there for them. And as well as that, stay with them until the first responders arrive. And this is because of the Good Samaritan law. So this North Dakota law states that any individual is protected from civil or criminal liability for giving naloxone for suspected opioid overdose. And this is important because it encourages people to call 911 in the event of an overdose and provide Narcan without any fear of any liabilities or repercussions. So how to stay immune or be protected: you will need to seek help, call 911, remain with that person until help arrives, and then cooperate with the responding personnel giving that emergency medical treatment. And so this is important because then people feel comfortable seeking assistance and they're not scared about getting in trouble for just trying to help someone that could be having an overdose. So now that we know how to give naloxone, why we're safe from any liability for providing it, where can you find naloxone? So of course, law enforcement, fire, and ambulance all carry naloxone. But as well as that, we have naloxone at First District Health Unit for two reasons. First off, we have the Good Neighbor Project, which is a nonprofit organization dedicated to breaking barriers and reducing harm for individuals who are impacted by unsafe drug use. But as well as that, we do provide naloxone to high-risk families, or if you know someone that you're concerned might overdose, etc. We will provide it, and as well as anyone that attends this class, you have the opportunity to get free naloxone as well. In addition to that, we have participating pharmacies carrying naloxone, and we'll try to provide it if they can with an opioid if that is prescribed, and as well as that schools will carry it as well. So taking care of naloxone, just a heads up, you cannot leave naloxone in your car. It should be left at room temperature, so freezing it would be very bad. So keeping it in your purse or just at home or anywhere that's warmer and protected from light, it should be good. Now, naloxone has a shelf life of about 2 years, and if it's expired, we at First District Health Unit will exchange you that expired one for a new kit for free. So thank you so much for listening. We really appreciate you taking the time to learn how to use naloxone so you can use it in the community in case to save a life. If you have any questions or concerns, please contact our Health Promotions Division. Our phone number is here. That is our office location, and then our website as well. And if you're ready to get your own Narcan, please click the link of the survey in the description below or on our website and fill out that survey to receive your free naloxone kit today. Thank you for your time.